Hey, what's up, guys? It's Dave, and today we are going to do a quick update on COVID-19 for first responders. So first off, in Virginia, as of today, we've got 12,038 people that have been tested. Of those, we've got 1,020 that came back positive. So if you look at the numbers there, we're right around about 8.5% as far as positive tests coming back. That is artificially high because a lot of places are not testing a lot right now, and those that are really focused on those really high acuity and high risk patients. Most hospitals are still just looking at inpatients, so people that are getting admitted and the people that are the sickest. So that is artificially high. Really in across the country, or actually across the world, they're looking at about 5%, and in the US it's actually probably closer to about 2%. So as we start bumping up testing, we are going to notice those numbers. The numbers themselves are going to go up, but also those percentages are going to come back down a little bit towards what we're expecting. So that's kind of the trade-off there. And as far as hospitalizations, we've got 136 that are currently in the hospital in Virginia, and we've had a total of 25 deaths. So again, that gives us right now a mortality of right around 2.5%. Again, that's artificially high because they're just testing the sickest of people. As we start testing everyone, I think those numbers are going to come way down. Right now, they're looking at right around 1% for what we're expecting. So 1% is a whole lot better. And if you break that down a little bit more, so for our local area, for those of you who are watching that are local, as of right now in the New River Health District, we've got still just that one case in Radford, that Radford University student, and one case in Blacksburg or in Montgomery County, which was that Virginia Tech student. In both of those cases, the person who tested positive did exactly everything right. So they, it was from travel. They self-isolated. They kind of quarantined themselves. They followed up with medical care and got themselves tested and didn't go around exposing other people. So that's exactly what we want. And if all of the people that have these risk factors are actually following the recommendations and staying home and staying away from people, then we're going to continue to have good outcomes with that. That said, chances are those numbers everywhere are going to be much higher. So realistically, we have way more than just one person in our county that has this disease. However, as we start to increase testing, we're going to start to find more and more of those cases. So as we bump up testing this week, don't be surprised next week when we start seeing more and more positives coming in. That's not something to freak out about. Don't think that it's necessarily getting better or worse. It's just we're now actually getting a good idea of our cases and where we are so that we can start to address it even better. So testing is going to increase. With that, the numbers are going to spike up, but also those percentages. So how many people wind up, having to go to the hospital or that wind up not surviving this are those percentages are going to start to drop as we start to test more and more people. So just something to be looking out for. They've also got some other data now that they're showing on the Virginia Department of Health website. So if you're curious about that stuff, check it out. One thing that is kind of interesting on here, the age ranges. Right now, there's not a lot of surprises on there other than the younger, so 0 to 9 and even that 10 to 19 are still pretty small on the numbers. But 20 and up is when we really start to see a lot of those cases. So just because you're younger doesn't mean that you're not going to get this. So, that college age where they're out kind of partying and having a lot of fun right now, they are still at risk. So you all need to be careful. Otherwise, not really any surprises there. Jumping over, so today is National Doctor Day, so shout out to all of our docs, both current and former members of our agencies or those who we've worked with before that are doctors or physicians, and all of those that are in school right now. Shout out to you, and thanks for all you're doing. Jumping over to the EMS Response Guide. So let me jump up to the top here. So we do update this very regularly. So for the EMS folks, hang in there and go through this. If you are law enforcement or fire or any other first responder other than EMS, just hang tight for a few minutes, or you can jump ahead. We'll cover the updates on that guide also. All right, so for EMS, make sure you are checking this current version. This does get updated regularly, so go to bit.ly/COVIDEMS, or you can hold your phone up to the QR code there and scan it, and that's going to get you to the most current version. This one was updated tonight, so it is 3/30 of 2020. So check that, but make sure you look for the most current version of this. It does change. Also, this is intended for EMS personnel, so while it's not anything secret and anybody's welcome to watch, the recommendations and guidelines here are recommended for emergency medical services. So for the general public or even for other first responders, you should wait till the next section or go check the other references there. All right, so when to suspect COVID, really the only big change on here is what you will notice is missing. And as of a couple days ago, we actually took out the travel portion of this. So for a while, it was dependent on if you had traveled to a high-risk area, and that's actually kind of dropped off of the screening criteria because now Virginia crossed that threshold, which was 500 cases. And once that happened, the travel questions kind of became irrelevant because at that point, we're asking a person if they've ever traveled or if they've recently traveled to a place that they currently are at. So that wouldn't make any sense, right? So travel questions are out. Symptoms unchanged here. So, fever, cough, or trouble breathing, diagnosis, or any other symptoms, or anything with a housemate. So anybody that you're living with in the last 14 days, or if dispatch recommends it. And dispatch is shifting away from travel questions too. So right now they may still be asking those, but in the next few days that'll go away. And even if they do, just factor that into your decision. But really whether or not they rank that as a medium or high risk possibility, just know that that's usually been based off direct contacts or travel, and the travel thing might not be as relevant now. All right, looking down, no real changes with PPE. Just a reminder because it's so important, goggles and a mask. A lot of places or a lot of people are just using a mask, but they're not covering their eyes. That automatically puts you up into a higher risk, especially if the person is not going to wear a mask. The patient is not going to wear a mask. So if they can't or won't wear a mask, definitely really critical that you are wearing goggles or some kind of full eye protection and a mask. Gloves are always good. Gown, really only if you need it. Kind of depends on the situation. And make sure you're putting a mask on the patient. They're really recommending conserving those N95 masks if they're in limited quantity for those higher risk patients. So the procedures that are creating a lot of risk, like bag valve ventilations or nebulizer, CPAP, anything like that, just any of those high risk. And really, if you have enough, really anything respiratory related, it's probably not a bad idea to go ahead and have an N95 if you have it available. Personal decon, no real changes there. Biggest thing, washing your hands still, so we're not changing from that. Gear and truck decon, no changes there. Just let it air out, wipe everything down, and you're good. If you think you've got any high risk things, so you got fluids on you, they coughed on you, you weren't wearing a mask, they weren't wearing a mask, you can check with your supervisor, check with the designated infection control officer for your agency, or you can jump down to page 4 on this document, and that's going to help you also. All right, so some of the big updates here from release notes. As of today, the medical directors are saying to keep an eye on this document for some medical updates that are coming soon. So my guess would be in the next few days, you're going to see some slight variations and tweaks there in some of the medical recommendations. So make sure you check back on this before you do anything. The COVID dashboard got added to this, which is the next page we'll jump to. And then a couple days ago, that's when we had our first positive, and also when the travel questions got removed. We also added these video tutorials, so now they're actually linked right from this document. So if you can't find this video, or you want to see all of the other videos, you can go to the link that's now confirmed in this thing. All right, so providers, this has not really changed other than, again, taking the travel out. So by showing up for duty, you're making sure that all of these things are valid. You don't feel like you have a fever. You don't actually have a fever over 100. No cough unless it's just like allergies, like the occasional clearing of the throat. No trouble breathing, no sore throat within 24 hours. In addition to that, in the last 14 days, you shouldn't have been diagnosed with COVID, shouldn't have anybody else in the house that's either been diagnosed or having those symptoms. If so, you may need to hold off on coming into work and check with your supervisor. And then you also haven't had any high risk or medium risk exposures in the last 14 days. So again, the travel stuff is out. Quick little dashboard like we talked about. I already showed you that at the beginning. Page 3, no real changes here on this tier disposition. For our agency, we're still in this tier 1, which is just normal patient refusal status, and we're not really changing anything there. We are not recommending people ride with us to the hospital with the family member, and all of the hospitals around us right now are not accepting visitors unless it's a special circumstance. So I recommend you let them know before you ever leave the scene that they should probably just not even bother going to the hospital. They're not going to get to visit anyway. The best thing they can do is sit at home and wait for the phone call when the person's ready to be released. We can, for your agency, if you want, you can be giving out this home care guide. So if you do have a patient that wants to get checked but does not want to go to the hospital, you can leave some of this documentation with them if it's appropriate and it makes sense. And that's kind of on an agency by agency thing. So that's where we're at now. If and when we shift to a tier 2, for our agencies at least, we're going to push that out. So I'm going to skip over those for now, but that is still something that we might go to in the future. For exposures, not a lot of changes here on the EMS side either. Still following the same thing. Let your supervisor and the infection control person know. Nothing really different on this risk matrix. But again, the biggest risk to you as the provider is if you are not wearing your mask and goggles. So at the very bottom there, if you are wearing a mask and goggles, across the board, you are in a low risk factor. So if you're wearing mask and eye protection, you should be good to go. If you wind up getting coughed on, spit on, anything else, then yeah, you may need to take off those clothes that you're wearing or shower, but you're still considered in a low risk, and that means you don't have to, stay home. You can get right back in the game and continue to care for people. High and medium risk, no real changes there. Nothing on the self-monitoring either. This is new since we last did a video. So this return to work policy, this is really going to be agency dependent depending on where you are with staffing and demand. I'm actually going to start on the opposite side here with the standard return. That's kind of where we are because we're not really hurting for staff right now. We're still in that capacity building phase of just getting everybody cleared and ready. But so right now we need to make sure that the person has not had a fever within 72 hours and 14 days from the onset of symptoms. So when those symptoms are gone completely, or 14 days, whichever is longer. So most people are going to be good with 14 days, but some people actually do take a little longer, and it just depends there. So then jumping over to the left, this is what is kind of new. So this has been added for agencies that need to implement this return to work policy. So on the far left here, it's the early return to work if you have been tested. So if you've got a test and they've all come back negative, then we're really treating that more like as if it was the flu or something else, in which case you haven't had a fever without any medication to lower a fever for at least 24 hours, and your symptoms have obviously improved. And if there's no test available, then instead of 24 hours, we're pushing that to 72 hours. So it's going to be either 7 days from the onset of your symptoms or once the symptoms are better, and make sure making sure that we haven't had a fever for at least 72 hours. In either of those cases, if you're kind of returning to work earlier than what you would normally do for the standard return, they are recommending that you wear a mask for the entirety of that shift so that you, just in the off chance that you do have something, there's no, you're mitigating the risk to anyone else. And also, this shouldn't really apply for anyone that's immunocompromised. So those are not currently being done by us, but some agencies are implementing that across the country. And just so you're aware, that is an option when necessary. And then the resources, not really any changes here. Again, for the WVEMS Home Care Guide, if you are not taking somebody to the hospital and they have COVID-like symptoms, you can give them this document, and that's just something that they can kind of track their progress with the disease with. And then also, if they do need to go to the hospital or to speak to somebody, it gives them some resources. The Western Virginia EMS Council COVID protocol. So this is another protocol that you can review. This is very similar to the above tiered response that we talked about. It's just broken up a little more officially for EMS providers. And then the videos, like I mentioned, here's a link to the videos themselves. And for those of you who are fire or law enforcement and the EMS stuff does not apply, check out the guide there. So there's that link and QR code. Not a whole lot has changed with this frequently asked questions either, so I'm just going to scroll through those, but I recommend if you have any questions, you should just double check this document. All right, that is it for the EMS update. We're going to jump over to law enforcement and fire and other first responders. So again, with law enforcement and fire, I recommend that you check the current version of this. You can go to bit.ly/COVID911. That's going to get you to the current version, or you can scan that QR code with your phone. All right, suspecting COVID. Not a lot of changes here. Again, just like the EMS side, we've just taken out travel. So everything else is the same. And we just are not asking those travel questions anymore because now Virginia is considered a high-risk state. So otherwise, nothing really changed here. Wear a mask, wear goggles. That's really number one. If you are wearing a mask and goggles or eye protection, that puts you into a much safer category across the board. So make sure you're wearing that anytime that you suspect that the person you're dealing with has COVID. Nothing else changed there. Personal decon, wash your hands. That's really number one. Everything else is important, but wash your hands really well. For vehicles, wipe everything down and let it air out. Jumping down to this, so making sure that you are fit for coming to work. Minimal changes here. Again, really the big difference is that they've taken the travel stuff out. So that's actually helped some agencies to put some people in that were currently being held back from being able to work. So that actually may be beneficial to your agency. But before you do that, you do want to make sure that they get screened to make sure that they don't have any of these other risk factors. So in the last 24 hours, they don't feel like they've had a fever, or they don't actually have a fever. They're not coughing, they don't have trouble breathing or a sore throat. I'll also throw in, I should have mentioned this with the EMS one, but some of the local hospitals now, in addition to the nursing homes, they're wanting to make sure that we're doing the screening, including ensuring that nobody that's working has a fever. So if you have a fever, that's always been important. You want to make sure that you're screening that out. But now, even for the emergency rooms, they're going to want to make sure that you can tell them that you've kind of been screened for that at the start of your shift, and also that it hasn't developed during your shift, and they may want to screen you before coming into the hospital. I know that's the same case for a lot of the nursing homes around us too. In the last 14 days, no real change there. Again, just taking out the travel. And exposures, basically this is all the same. Just like I mentioned in the EMS video, for responders, just make sure that you have a mask and eye protection. If you do, then all the way across the board, no matter what happens with the patient, you are still considered in a low risk. So you don't have to, come off duty. You don't have to not work. If you had a mask and eye protection, then just standard decon and you're good to go. If you got fluids or got coughed on and they weren't wearing a mask, you might need to change or shower, but otherwise you're in a low risk. What to do about it? Nothing there has changed. It's all really focused on we're trying to get testing on the source, so the patient, the person that's sick, not necessarily you. If we can test them, that might benefit when you can go back to work. Some of you might want to wait, but for those of us who want to get back and help, then yeah, checking that source is really important. Here's another link to the videos. So for the law enforcement and fire side, bit.ly/COVID911 videos. That'll get you to the playlist of all of these videos. And then for those of you who are in EMS, you should be watching or looking at the EMS guide, so there's a link to that. No real change on the frequently asked questions, so I'm going to skip over those. A couple other quick things to wrap this up. For New River Health District, this is the hotline. This is really what we're pushing people to call if they want to get tested at any of these kind of drive-through or out of the clinical setting testing locations. They need to call this number. They're going to get screened, and based on the criteria and availability, they're going to get scheduled for a test. And that's going to start expanding here over this week. So make sure that they're calling that number. Right now it's 8 a.m. to 8 p.m. Monday through Friday, and they've got some hours on the weekends too. So if anybody calls your station or your department and has questions, really the best option is probably going to be to refer them to this hotline. This way it's going through the health department and it's going through all of the current guidelines and recommendations. And that's who's going to be able to schedule them for a test if it's indicated. For the responders, this is also kind of important. As we progress through this thing, it can be challenging for some of the people that we deal with and also for ourselves and our family. So just remember there's other help options out there. We do have a local recovery support line set up that is open every single day from 9 a.m. to 9 p.m. Carillion Clinic and several sponsors put that together, and this is for mental health, substance abuse, or anything related to that. So this can be for you, for your peers, your family members, anybody that might need a little extra help during this thing. Also, most of you are aware, so today our governor sent out a few updates, really today and yesterday. So I'm going to run through the executive order, kind of just some of the highlights that impact us as first responders real quick. If you're comfortable on all that, that's the end of the video, so you can stop here. But if you want to go through the most current updates, which is the stay-at-home order that went out today, and then also the document that went out a couple days ago preceding this, then stay here and watch this. All right, so the executive order, it's number 55. That's the stay-at-home order. Basically it's saying everybody needs to stay home unless they're doing one of the things that are exempt, which is actually a lot. So if you actually read through this list, I'm not going to sit here and read it word for word, not a lot has actually changed. It's really more just formalizing a lot of the things that's already been said for the last week or two. So not a lot of changes there, especially on our end, not much that's going to impact us as law enforcement. People can still go out, get food, get, supplies. They can go seek medical attention. Government services, law enforcement, emergency services, all that's still good to go. Taking care of other people, animals, visiting family and friends, traveling for court-ordered things. Anything outdoors, for the most part, is still okay as long as they're maintaining that social distancing. Traveling to and from your house, so like anytime you're coming or going, that's kind of covered. Place of worship or work. So between that, I guess as long as you're not going from one place to another without first going home or coming from home, you're okay. Traveling to and from education, so going to school, volunteering with organizations. None of this supersedes or stops any of the things that were allowed by that previous order, which includes all of the emergency services and critical stuff that we do. So that's all still good. Some updates to camping, fishing. So all you that are into fishing, you can still go fishing. So that's good. You can still go to the beach, but only if it's to go fishing or to exercise. So I guess if you're at the beach, make sure you leave some space there, but you can still do that too. That's kind of far for us, so I'm not going to the beach, but this is, I guess, where it really plays in for the law enforcement folks. So violating any of those previously mentioned things for this order shall be a class 1 misdemeanor, and there's the code section, so that's something that law enforcement can enforce. I know that that varies from locality to locality, so just follow your local policies there. And that order shall be effective today, and it remains in effect until June 10th unless it's amended or taken down. So they are kind of pushing this out quite a bit more. Up until this, they were really kind of going by this like 2 weeks at a time thing, and we all kind of knew that was a little silly. So this one's really pushing out there to June 10th in the hopes that that's more of a realistic answer of when we'll be over the hump and be able to start kind of working our way back towards normal. So that is the order that came out today. And then number 53 that came out a few days ago, not much different there. Really, this just kind of clarifies certain things. So if you need more clarification on that previous order, it does refer back to this one where it lists some of the things that are exempt. So you can go into that and check that out if you need more ideas and kind of clarification there. But yeah, that's it. So hopefully you found this helpful. If you have any questions, please leave them in the comments, and I'll try and get you some answers as soon as I can. Thanks. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.